Hello, I'm Dr. Cline, inviting you to listen carefully for the next few minutes. What I have to say will be of great benefit to you. At the conclusion of this brief tape, I will discuss with you the results of your examination and make necessary recommendations. But first, I would like to explain my feelings about the doctor-patient relationship. It seems that many doctors these days are more interested in charts and tests than they are in the patient. Now, charts and tests are important, but I feel that in far too many cases, patients are treated like numbers, with doctors not taking enough time to really communicate with them. Most doctors are very busy and sometimes get behind, therefore not spending adequate time with patients. But I want you to know that here, the entire staff cares and encourages you to ask questions about your health. If anyone seems rushed, grab them by the arm and say, "Hey, I have something I need to talk to you about." Too many doctors feel they do it all. That's just not true. It takes both the patient and the doctor working as a team to get results. If the doctor doesn't do the job, the patient won't get well. However, if you, the patient, do not do your job, such as keeping scheduled appointments, following instructions, and adhering to treatment recommendations, the results will, of course, be less than desired. It truly must be a team effort. Some patients discontinue care prematurely, thinking that just because they are out of pain, they are well. Then in a short period of time, they experience the same problems again, and this time maybe even worse. Simply put, the problem must be corrected, not just patched up. The longer one puts it off, the longer the healing process takes, the more damage is done and the higher the cost of getting well. I want you to understand about pain, what it is and what it isn't. Pain will diminish as the vertebra is moved off the nerve. However, the spinal condition may be only partially corrected, say 20%. If you discontinue treatment at this point, the vertebra will heal where it's sitting, still 80% out of place, and still interfering with normal nerve function. Each treatment you receive moves the vertebra only a small amount back towards its proper placement. It's like driving a wedge into a tree, just a little movement each time the wedge is tapped. During your personal report, I will refer often to the subluxation. In simple terms, correction of the subluxation can be compared to that of adjusting a dimmer, controlling the flow of electricity to a light bulb. Of course, the more power reaching the light bulb, the brighter the bulb glows and the more light it provides. The basic purpose of the chiropractic adjustment is to restore or increase the flow of nerve energy to all components of the body. I want to know immediately when you are out of pain. But more than that, I want your spine to be as healthy as possible. Frankly, if all you wanted was to get out of pain temporarily, then maybe aspirin would be a better answer. Obviously, it would be less expensive. But it wouldn't work for long, and it would do nothing about the cause of pain. Aspirin would only cover up the symptoms. The cause must be identified and corrected, which is exactly what we want to do. It is hoped that you will make the commitment necessary to allow for the fullest amount of healing possible. Chiropractors have treated many cases of headache, sciatica, bursitis, arthritis, and so forth, and the patients who have followed through with recommended care are the happiest people today. Patients often say, "Doctor, one of the best things you ever did for me was to urge me to follow through a treatment. I haven't had any serious problems since following your advice." We will teach you how to control your problems and enhance your general health. We are constantly reminded of the old proverb, which is better, to give a man a fish and let him eat for one day, or teach him how to fish so he can eat throughout his life. I will be joining you in a moment to present your personal report of findings, including our best judgment of what care is best for you. If you are accepted for care, you will be seen on a schedule that involves only treatments you need and only when you need them. Therefore, I will insist that you adhere to your personal treatment schedule. I want to thank you again for the trust and confidence you have placed in our chiropractic care.